Speaking of bananas, everyone will think of beaches, sunshine, coziness, relaxation, etc. Bananas are not only good looking, the taste is also very sweet. Banana is one of the 4 largest fruits in the world. Bananas can be eaten raw. You can also be stewed and made into dried bananas or preserved fruits for consumption. It is full of energy. At the same time, bananas also hide many health secrets. Bananas have medicinal value in treating fever, polydipsia, dry cough, constipation, and hemorrhoids. Bananas are nutritious. It is a recognized beauty and weight loss food. Rich in carbohydrates, protein, fat, starch, pectin, calcium, phosphorus, iron, potassium, keratin, vitamin B1, vitamin B2, vitamin C, crude fiber, and other nutrients. Especially the potassium content is high. In addition, it also contains small amounts of 5-hydroxytryptamine and norepinephrine. Eat a banana each for breakfast, lunch, and dinner. Can provide abundant potassium to the human body. This reduces the probability of blood clots in the brain by about 21%. Modern medical advice. Bananas can cure high blood pressure. Because it is rich in potassium, can balance the adverse effects of sodium, and promote cell and tissue growth. Bananas can treat constipation, because it can promote gastrointestinal motility. In short, the vitamin A contained in bananas can enhance resistance to disease. It is needed to maintain normal fertility and vision. Bananas are easy to digest and absorb, safe to eat from children to the elderly, and provide balanced nutrition. Banana is a low-calorie food. Even people who are losing weight can eat it to their heart's content. Here we look at the relationship between bananas and cardiovascular health. What exactly can it do for our cardiovascular system? What benefits does it bring? Bananas are rich in dietary fiber. So every 100 grams of bananas has about 1.3 grams of dietary fiber, accounting for about 5% of our total recommended daily intake. Also provides about 10% of daily potassium requirements. You can achieve a good nutritional ratio to meet the health needs of the human body. Among the many nutrients, potassium is extremely important for cardiovascular health. Can regulate the body's normal acid-base balance. It's an important electrolyte. It is also the main cation in our cells. It helps us control blood pressure, maintain normal functions of muscles and nerves. There is an authoritative paper, Potassium Intake in Stroke, Prospective Studies of Cardiovascular Disease. The main purpose of this article is to discuss, in our daily diet, potassium intake in cardiovascular and cerebrovascular diseases. In particular, there is a relationship between stroke and cardiovascular disease. The researchers attempted to conduct many prospective studies of this kind. Let's further analyze whether this one is related. Drawing analysis method was adopted. Draw a more reliable conclusion. Indicates the potassium intake associated with risk of cardiovascular and cerebrovascular diseases. So to be specific, potassium appears to be linked to lower risk of stroke. It's this kind of daily life. Our potassium intake, it can be used to prevent cardiovascular and cerebrovascular diseases. Then this also provides guidance for our public health, especially in the recommended daily diet. Potassium intake provides a very important basis. He emphasizes that through diet, the importance of taking in the required amount of potassium. So especially in terms of preventing cardiovascular and cerebrovascular diseases, the importance of potassium intake in our daily diet provide a helpful scientific support. Then the fruit rich in potassium is banana. Its content is still relatively high. Approximately 1 banana has 357 milligrams of potassium. 1 to 2 bananas a day can achieve the effect of potassium supplementation. You can also get some other nutrients contained in bananas, but don't need too much. If you take too much in a short period of time, it will cause a sharp increase in magnesium and potassium levels in the blood. Causes imbalance of potassium, sodium, calcium, magnesium, and other elements in the body. Harmful to health. Also, eating more bananas will greatly reduce gastric acid secretion and cause gastrointestinal dysfunction and excessive mood swings. Therefore, the amount of 1 to 2 sticks is relatively appropriate. Of course, when we eat bananas, there are also some precautions. Is it possible that bananas will cause this blood sugar to rise? So can this banana be included in people with malignant diabetes? Or prediabetes? What about the diet of this group of people? Many people will have this question. So it is generally recommended for people with diabetes. it would be better to choose foods with low glycemic index. So this glycemic index just measure this food, an indicator of elevated blood sugar levels after eating, also called G-value. Then the G-value is generally 55 or below. This means that this food will not significantly increase blood sugar. There is another indicator, the glycemic load value, which is a more specific indicator of measurement. Consider more than just the glycemic index of food. Also consider the carbohydrate content in this food. A score of less than 10 points is more reasonable. But this is a food with a low glycemic load value according to international standards. The J value of banana is 51. GL value is 13. Bananas have a relatively low glycemic index, but his blood sugar load value is relatively high. So for people who are more sensitive to blood sugar, for example, pre-diabetes, this group of people with malignant diabetes, you need to control the carbohydrates in your diet. In fact, it is very important, although the glycemic index G value of bananas is relatively low, belongs to medium level. But because it has a higher carbohydrate content, one of its glycemic load values is relatively high. Carbohydrates in bananas, mainly in the form of resistant starch, although it has a relatively low impact on blood sugar, but it still has an impact. If you want to eat, to control the quantity, it is best not to exceed half a root, and it should be paired with other low G foods. To reduce blood sugar response, we still need to pay attention to the amount of bananas we eat. Don't overdo it. It is better to reduce other foods when eating bananas. Second note, that's for people with end-stage renal disease. People with advanced renal failure pay special attention to potassium intake. Because of renal insufficiency, the body has trouble getting rid of excess potassium. This may cause hypokalemia, thereby increasing the risk of heart disease. Some high potassium foods. For people with end-stage renal disease, be sure to pay attention. You need to adjust your diet strictly according to the doctor's recommendations. At the same time, some other high potassium foods. For people with end-stage renal disease, you also need to be very careful. The third note is not to eat raw food. Unripe bananas have a higher starch content, up to 70% to 80%, far more than a ripe banana. It contains a lot of starch, very unfavorable for human body digestion and absorption. You may experience indigestion after eating it, abdominal bloating, diarrhea, etc. occur. Then the fourth thing to pay attention to is, do not eat bananas immediately after a heavy meal. This will increase the burden on the digestive system. It is recommended to wait 1 to 2 hours after meals. When the gastrointestinal function recovers a little bit, eat more bananas in moderation. This is more appropriate. The fifth thing to note is, although these natural bananas are very healthy, but some processed banana products, for example, processed into banana chips, banana bread, etc., most of this is processed by frying or other processes, will significantly increase the sugar and calorie content in it. There may also be additional oils or even syrups, etc. So these banana processed products, although it still tastes like banana, but the nutritional value is the same as that of fresh bananas. There is an essential difference. For people concerned about blood sugar and heart disease, the intake of processed foods should be reduced. Opt for fresh bananas instead. This is what everyone needs to understand.